Natural Talk with Angel. Today's guest is Dr. Adam Podraza. He is with Lighthouse Chiropractic. Thank you for being with us, Adam, or Dr. Adam, I should say. Thank you so much for taking the time out to talk with us today. And I want to ask you to explain to us a little bit about how you got into the chiropractic field.
Sure. Thanks, Angel. First, I just want to say thank you for having me on. It's my pleasure to be here. I always love educating the public about what chiropractic is and isn't and why we do it. And so why am I a chiropractor? I was a New York City ironworker for 10 years. I built skyscrapers and I had very little education. I had been adjusted for accident cases previously, like a workers' comp. And I've been adjusted, but I just went in, did the run of the mill, get your treatment and you're out. And a buddy of mine who I lived with at the time, he invited me to go on a mission trip. And when I went on the mission trip, I was introduced to the amazing part of chiropractic about innate intelligence, about the miracles that can happen when you get adjusted, about your foundation of healthcare being chiropractic. And I fell in love. For 4 days in Dominican Republic, I was literally glowing. I had so much energy, and I was just a volunteer too. I wasn't a chiropractor at the time. When I was done with that mission trip, at the end, I told everyone I was going to be a doctor. I would be back, and I did that. And here I am. I'd say 10 years later in Florida, practicing with my wife. She's a chiropractor too, and that's where we're at.
That's awesome. That's an awesome story.
That's the abridged version, by the way. There's more to it, but yeah.
Can you tell us what is the difference between a chiropractic doctor and a mainstream, family practice or regular doctor? Oh.
What's the difference between a chiropractic practice and a doctor? Sorry, you broke up a little.
Yes. I'm sorry.
Well, no, you're fine.
Internet problems.
Yeah, and I don't have the best signal here, so it might be a little choppy. But I'm coming through clear. You can hear me good, Angel?
Yes, I can.
Okay. I would say the one real main difference between chiropractors and general physicians, general practitioners, is our choice of treatment. It's the tools that you have in the bag, right? So general practitioners, their tools are medications, referrals, and surgeries. That's what they can work with. And we have some of the best in the whole world here in America. But the difference between that and a chiropractor is that we adjust. We use the body. These are my tools right here. We don't prescribe medication. So when we were trained in college in chiropractic school, instead of the hours for pain meds or other prescriptions, we were taught more on the spine and the nervous system and x-rays. And that's our go-to every time. If someone says, how are you going to work on this? Adjust. What are you going to do to fix this? Adjust. What are you going to do to it? It's always adjust. Adjust is always the answer when it comes to a chiropractor.
Okay. So is there ever a time that you would refer a patient to a traditional physician?
Definitely. Doing what I do, I like having great referral sources, just so you know. I don't like referring people to places that I don't feel comfortable going to myself. So I like to build those relationships with other professionals, but definitely, for sure. A couple examples, and this actually happened a few weeks ago, was someone with high blood pressure. They come in. Can chiropractic, has it been shown to positively affect blood pressure? Yes. Does it treat blood pressure specifically? No. The spine, we treat the spine, and then everything else happens, right? So a patient came in, no names, HIPAA, of course, got to watch that. But he came in with the blood pressure of 150/97. So that right there, that's a quick referral. And we have Primary Baptist right across the street. So that there, I'll continue to treat the patient. They still need the chiropractic care, but that definitely for sure needs a referral, and I refer them right out because that's not our scope. We don't deal with medications. We don't deal with that. If there's ever an emergency situation, we'll send that person right out, ER, right away. Anything outside of actually working on the spine is outside of our scope. So yeah, I refer out a lot of times to general practitioners and other professionals, DOs, surgeons. Gosh, yeah, there's a there's a group of people that we'll refer out to. Yeah, definitely.
Okay. Now, we know that the typical, you see the ads on the TV and everything that say, accident victims and this, that, and the other. Are there other types of things that you treat for that we might not necessarily associate with chiropractic care?
Yes, thank you for asking that question, and I love that question because it's there's several parts of that question that I want to address. The way that you actually ask the question, what do we treat outside of accident cases? Just to be clear on this, we don't treat anything. And a lot of chiropractors, maybe they'll be specific on this, maybe they won't. Legally, you have to be specific. But we don't treat neck pain, back pain, headaches. We don't treat conditions. We treat the spine. Always and everything. You actually, legally in Florida, you can't say that you treat certain conditions. The verbiage, you can't use it because the truth is we treat the spine. We adjust the spine and let the spine do what it needs to do. And I'll give you an example of that, Angel, if you don't mind. If you cut your finger, if I cut my finger today, I wouldn't think, oh gosh, I can't go to work later, or I was going to go shopping. Now I have to stay home and I have to heal this finger. I have to concentrate. I'm getting a lot of this napkin all over me. I hope it's not on my face, but I have to concentrate and heal my finger. You don't do that. You just count on the body to heal it, and it does its thing, and then you realize later it's scabbing up, and then a day or two later it's gone. So it's the same concept, except you put it on a grander scale. You adjust the spine, and the connection of the brain to the body works with certain things. I just went to my buddy's house over the weekend, and I was in horrible pain. I was in Atlanta, and my neck was killing me. It was some of the worst pain that I've had in years. Throbbing pain right here, which is good, by the way, to be empathetic for patients. You want to feel what they're feeling every once in a while. But one adjustment, and it was gone. So he didn't treat the pain. He just removed the interference, and the pain left. The second layer to that question that I want to address is what chiropractors have been pigeonholed into over the last few decades. Did you know, Angel, that before the 1960s, chiropractors were more known for treating visceral issues than actual pain symptoms?
No,
yeah.
I didn't know that.
Yeah, look it up. Chiropractors before the 1960s were actually more predominantly treating issues of visceral nature. For people that don't know, that's like heart problems, stomach problems, digestive problems, liver, organ issues. We were known for that. Something happened around that time. The insurance age, accident cases, I'm not sure. But we got more into neck pain, back pain, headaches, and now we've been pigeonholed into that, where people think that that's really all we do, which we are experts in that. I'll say that strongly. Neck pain, back pain, headaches, that's a lot of what people come for. But your question was, what do we actually work with outside of accident cases and pain, which is a very good question. Some things that people don't know that we work with, that, better way to phrase it, that has been shown, chiropractic has been shown to help, right, is anxiety, depression, and pregnancy. Those three things. So we had a patient that came for hip pain, I'd say last year, about this time last year. And 3 months into treatment, she turns to me and she says, Doc, the anxiety I have is really going down, which, by the way, that happens a lot. People don't want to tell doctors everything. They want to go with the easiest fix, and they're like, no, I don't want to tell them that, tell them that. So a lot of times I'll ask how they're doing, and they're like, gosh, you know, that chest pain's gone. I'm like, chest pain? What chest pain? What were you talking about? You never brought that up, chest pain. So she had never brought up that she had been battling anxiety. And she said, yeah, the anxiety's, you know, down a lot. I feel wonderful. And she had said she's no longer taking her anxiety meds. And I want to be clear on that as well. Prescription is out of chiropractic scope. So I never tell anyone to go on or off prescription meds. I might suggest to speak to the doctor that put you on the meds to see if they're still reasonably in the right dosage or necessary at that time to get checked again, but never say go off medications. But she had said she stopped, and she's like, it's unbelievable. It's amazing. I never expected it. Same thing with depression. But the last part, I guess, is pregnancy. So this is the most interesting thing, and I think this is about one of the other questions that you had, so you could probably just piggyback right into that, or I don't know. But a lot of times I will tell people that I've adjusted my daughter since she was in my wife's womb, right, all through pregnancy, and I adjusted her 3 hours after she was born, and you should see their faces. They're like, what? Why? Was something wrong? Was something wrong with it? It's like, no, nothing was wrong, and that's the point. I don't want there to be anything wrong. That's something that our community and our world has zero or very, very, very little information on, that you can get adjusted as your platform of healthcare. I'm not saying don't have the other part. I'm just saying you can, and there are a lot of families that base their health on getting adjusted first, letting the body handle what it can, and then seeing where they need to go. So on that idea, the nervous system controls everything. It controls your whole body. Your spine is connected to every organ. It's actually the first organ that's created in the womb, your brain and your spinal cord. And then everything else is created off of it and built off of it. And if you're a growing baby, a growing toddler, where your body is growing at exponential rates, it's just exploding every day. Kids are getting bigger and smarter. Wouldn't you want a nervous system that's clear of interference so that it can grow better, so that it can heal better, so it can function higher? I would. So that my daughter's been adjusted 1 to 2 times a week for 3 years since she was born. And she doesn't have neck pain, back pain, headaches, nothing.
Wow. That's awesome. That's awesome. I never would have thought about an infant. And I guess most people wouldn't. So that was great that you brought that up.
No. And just so you know, most people think of chiropractors as going the whole right and powerful movement adjustments. When you adjust an infant, you really are putting doorbell pressure on the segments in the neck. You're pressing about doorbell pressure, holding it until you can feel the release a certain amount of time, and then you just release. And then the mid back is more of a like this. It's not high speed, low velocity adjusting. And you can even use instruments, activator. You can use that too. So
now I do know that in chiropractic care that they use a lot of other instruments like the stimulators, the TENS units and massage beds and things like that. Are those things like necessary for healing, or are those just like extra, it'll help you make you feel better?
I would go a little bit of both. Some of them do make you feel better. The roller table bed makes you feel better for sure. People love that. They lay on it as like a massage. The neck traction, and these are what we have in our office. The neck traction gives you a stretching, soothing feeling, and you're putting your neck in the proper position. So yes, you do feel better. But you don't need those things, and there are certain chiropractors that don't use them. The most important thing is the adjustment. If you are key on that and you're good at adjusting and doing what you do, that is the true healing, the adjustment. But that being said, neck traction is a great addition, and it helps restore the normal curvature of your neck and open up the segments. So it does have a purpose other than feeling good. Wobble chair, what we do in our office, is good for the discs. A lot of people don't know that for the discs in between the bones to function properly, you need to move. That's why movement is life, and sitting and not moving is death. It's not good for you. They actually need to pump. So there's a point to doing that. And then the vibration table feels great, but it also opens up the segments and massages the disc. So it's shown to help hold the adjustment longer. So we choose to do those as supportive therapies to help the process along, to speed up the goals of what we're trying to accomplish. But no, they're not necessary completely. It's really just the adjustment. It depends on who you want to treat and why you want to treat them. Laser therapy works wonderfully. It helps a lot. But it is also for treating a symptom, treating a problem. I think, again, that goes into one of your other questions of why chiropractors do what we do, and the purpose of treating symptom versus enabling health to grow. Chiropractors are very different from the medical providers, and it is a difficult transition to explain to people. Most people, and myself included, look for a quick fix. We look for a one-stop shop. I have a problem, fix my problem. Instead of fixing the problem, more focusing on growing your ability to heal, your life force, growing the positivity. Instead of focusing on the negative, build the positive to overcome. I have another example of that, if you don't mind, if that's okay. I was coming down with something several months ago. Gosh, I'd even say it was the end of last year. And I was in the office and it just didn't want to go away. And I'm thinking, man, I'm going to go across the street and I'm going to go see the GP over there and just see, if there's something I could do. I've been getting adjusted. I've been eating healthy. I've been doing all that, which chiropractic is great. It doesn't make you superhuman, just for everyone to know. People come in and they feel pain and they're like, doc, but I'm getting adjusted. It's like, yeah, that's not, it doesn't stop everything. But it's so weird. I had this epiphany, and I looked at our supplements and I thought, wow, probiotics. Why don't I take some probiotics? So people are so used to antibiotics, where like they're taking something to bring down the negative and to stop whatever is happening inside them. You can focus on the positive as well and build up the positive to overcome whatever's happening. And in that moment, I did that. I decided to do that, and I took some more probiotics, and I got better. Now, is that the case for every person? No. Every case is different, and a proper consultation and diagnosis is important. But the concept of you don't always need to focus on whatever's ailing and crush it versus building the positive and building that up. A lot of people don't realize that when they're sick, that's their body expressing health. When you get a fever, it's raising the temperature to burn off bacteria. It's doing that on purpose. When you throw up, your body's trying to get whatever's sick out of your stomach. So I would argue that that's healthy. That's not sick. Your body's doing the right thing. And other symptoms, coughing and getting stuff out of your lungs, your body is trying to get something out. It's doing the right thing. So you may feel like you're sick, but your body's expressing health when you're in that position. I think I answered your question. I ran around there a lot, but you want to bring me back to the book.
Okay, you did. You answered most of them. I did, and you brought up another one that I didn't have on here, was about supplements. So supplements is something that you or chiropractic care is very much in line with, correct? So you like to use a lot of different types of supplements for different issues?
Certain ones, we are specific, and I feel that way just like I feel like referring. If I refer a patient to a place that they don't treat them as well as I can expect, I won't refer them again, because that looks bad on us, right? So it's the same thing with supplements. We're really specific. We just don't pick any brand and throw it in there. ACF is amazing. Magnesium is amazing. There's a couple others, a probiotic that has over 10 billion units. If you're not getting the right probiotic, it's not doing what it's supposed to be doing. So we have those just in case. We don't push them, but we do have them just in case. And yes, the right supplementation, the right help can make a huge difference in the health of a person. There was another question you had about why does someone come to a chiropractor more than one time?
Yes.
And this is a really good question. Is it okay to jump right into that one, or you want to ask
actually,
it, or
that was my last question
it?
for you. So yes, go right in.
Great. I love that question. I feel a little sweaty. It's getting hot here. The summer sun is coming out. Can you still see me with this glare?
We can. You're just below the glare. There you go. We can see better there.
There. Okay. So, why does someone go to a chiropractor more than one time? If I could help everyone with all their issues with one adjustment, I would be a billionaire. It's not possible. Does it happen? Yes. And those are the miracles. It definitely happens. But again, our society is built into the concept of one-stop shop. I want help today. I want you to fix it. I don't really have, what's the word? Taking ownership of the problem, self-ownership, self-responsibility, you know, your actions, what you're eating, what you're doing, the thoughts that are going through your head, the job you have. People think just because, and this is a long answer, if you don't mind. People think just because office buildings and cubicles that's normal and we're supposed to be there. It's not. Just so you know, that is not normal. That is very abnormal. We are creatures that are meant to be out in the sun moving, and that's not possible with jobs that we have today, but they don't consider that a stressor. If I tell someone, look, I want you to do a neck exercise 3 times a day and pull your head through your neck, you know, for 10 seconds, 4 times, they're like, Doc, man, yeah, I got to remember to do that. If I had told you to sit down for 8 hours as an exercise, you would think, oh my God, that is like 8 hours. That's crazy. But if you do it for your job and you're not thinking about it as an exercise, it just happens all day and you just do it. So you don't realize that's an unbelievably tough stress on your body. When someone breaks a bone, you know, for sure, 6 months. That's how long it takes the body to heal, 6 months. So why is it any different for your nervous system to heal in a certain amount of time? The concepts of chiropractic, and I say this respectfully because I love my profession. I was an iron worker. I was not brought up in this world, so I don't have a lot of the biases. But I would say that the communication that has been given out to our community, which has been blurred by other professions wanting us to not succeed, and also blurred by chiropractors wanting to just become successful and not really knowing exactly, you know, what's happening and the research to what's happening. But the way to educate of what's happening is not, it's not truly there. It's not, people don't understand what's happening with the body and what happens in one adjustment. People tend to think like, oh, you're going to put my bones back in place. You really don't move them that far. I mean, it's like a millimeter. It's not, you're not moving bones inches when you adjust someone. You're allowing the proper mechanism of the spine, the proper movement to be restored so that the brain body message is connected. It's not there. So why does someone need to come to a chiropractor more than one time? First of all, some people don't. It depends on the person. It is a varied thing. We call it finding a sweet spot, right? So some people, when they're doing well, we're not talking an acute condition. We're talking they're healthy, they're functioning right, and even underneath the surface, they're doing well. Some people can come every 2 weeks. Some people can come once a week. Some people come a month, once a month, once every couple months. And that's for a checkup. It's not always for an adjustment. It's just to get checked, right? So everyone has a different sweet spot, what's right for them physiologically and lifestyle-wise. If you're an athlete and you really put a lot of pressure on your body, you're going to need more adjusting than the average person. If you're acute and you have a major problem, you're going to need more adjusting than the average person. But where do I think that it really gets lost? I think it gets lost in the chiropractors that are afraid to tell someone, well, there's two spectrums of this. It's a wide spectrum, okay? And I may get slightly in trouble for this for other chiropractors that see it, but I don't care. So there are chiropractors out there that will not tell you, Angel, that you need to be on a care plan because they're afraid that you're not going to buy in and they don't want to lose you as a patient. Now, I had an office in Atlanta, Georgia, inside a CrossFit gym. It was my first office. It was a satellite for another guy. And I saw a good handful of patients that had chiropractors, family chiropractors, and they would come in and they'd say, yeah, you know, typical thing to hear. I only go when I need it. You know, I see my chiropractor once every couple weeks, or, you know, if it's more, you know, and I've been going to XYZ for 5 years, 10 years, 20 years, 50, whatever it is, right? And then you do the consultation and they're like, yep, I have the worst low back pain. It's been bothering me for 20 years. I have neck pain that radiates down my arm, and I'm actually mimicking a specific case, but this isn't far off, right? I have headaches all the time, and I'm like, so wait a minute. So what exactly has been happening over these last 20 years? And we take x-rays, and the spine is abysmal. It's a garbage. The spine looks horrible, right? And I have to look at the person, and I have to say, look, you need to be on a corrective plan. That means I need to see you 3 times a week, 4 times a week, because your body needs that to stop the degeneration, to get you functioning to the place where you need to be. But there are practitioners out there that don't want to say that because they're afraid they're going to lose you as a patient. They're afraid to tell you what you need to hear because you don't like it. One, it's going to cost more money, and it's going to take more time. The 2 things that you don't want as a patient coming in the door. You want this fixed as quick as possible and as inexpensive as possible. So those 2 answers are not what you want to hear, but it's what you need to hear, because getting adjusted once every couple of weeks when you have major problems, yes, it's going to make you feel better. Yes. And I tell my patients this all the time. If that's what they choose they want to do, I'll support it, but I'll be clear about it. It's not going to correct what's going on. You can use it as a Band-Aid. You can use it as a Tylenol. You can, and I say that, you know, in just a phrase, not a Tylenol. I mean, to take away the pain. But it's not going to correct anything. And that's where people get the whole, oh, I was good under care, but when I stopped, it came right back because you didn't do the full correct care. And that practitioner will tell you, well, yeah, don't worry, Angel, just come every 2 weeks or come when you feel you need to come, when it comes back, and I'll take care of you. And they're happy to take your copay and your payment for 10 years. Plain and simple, but they're not worried about the Angel 20 years from now, 30 years from now, 40 years from now. So they're not going to tell you that. And they tell their patients this. And I've had to work with people like that actually have walked away, and they come across with that, well, my old chiropractor, he was great. I felt great. I only saw him when I needed to. So I really don't. And they say this right when they come in. They say, I really don't want to do some care plan thing. And I have to explain to them, well, Mr. Jones, your spine looks really, really bad. And why does that matter, Angel? Because people base how they, and I have another answer, the other end to this spectrum, right? People base their health on how they feel, which is dangerous because you don't feel cancer. And I'm talking about before you actually have major, major symptoms. I'm talking when you have stage 4, stage 3 in you, which I have family member that has had it, and I have had family members that have died. So I don't speak of this lightly, but you don't feel it. You feel wonderful until you go in for your annual checkup and they go, you have breast cancer. We need to act quickly. You know, you felt fine. You feel fine on diabetes. You feel fine before your heart attack tomorrow when you're dead. 50% of the first symptom for major heart attacks or heart disease is the heart attack that kills you. But those people felt fine. So feeling has very little to do with it, okay? But most people do that. They act on how they feel, and if they feel good, then they don't need to get adjusted, which is wrong. You should get adjusted before the problem happens, but that's a whole different story. The other end of the spectrum of why people need to go more than once, the early end of the spectrum, the one side is the practitioner that doesn't want to tell you that you need to be seen for a certain amount of time, right? Then you have the other end of the spectrum, which is the spectrum where you're being sold on a care plan, where that's all that practice does, and it is a business, and they're very good at it. And is it absolutely necessary? I don't know. I don't know if I don't know, until you do a good history and a good diagnosis and see where that patient's at. But there definitely are some places that it's all about business, and it's just get them in, get them under care plan, 6 months, a year, 2 years, whatever it is. And is that equally as dangerous? Yes, it is. So it's hard to find that middle ground of being trusted and respected to say, you need a care plan, you don't need to be coming as much. It really depends on the person. And that being said, you can start working on someone and they can get worse because they had other issues, underlying issues that are coming up. Gosh, there's another point to that. Anyone who sells a care plan to you without explaining, or putting their hands on you and figuring out where you're at, they have no idea how long you're going to heal or when you're going to heal. You can't figure that out. There's no possible way. Some people heal quicker, some people take longer. So the best thing to do is to be honest and to explain what's happening and to be down that road with people, That's what we do in our office.
Well, that was awesome. Thank you so much. Thank you so much for your time today as well. You're sweating to death there, so we won't keep you much longer. I do want to give you an opportunity to tell a little bit about your practice, how people can find you, if they'd like to come and take part of your services.
Sure, thank you. That's wonderful. So my wife and I are the owners. Oh, and thank you, Angel. This has been great. You are wonderful. Thank you for the time. I'd love to come on again, by the way, because there's so much to explain. This is just the tip of the iceberg. But my wife and I, we own Lighthouse Chiropractic, which is on US 1, 2 miles south of Nice High School, 5 miles north of Palencia. So it's in that shopping center where the new Irish pub is located. We're right on the corner.
I think we're breaking up.
We are a family-based chiropractic office, but we also do see accident cases. So if there's a car accident.
I think. Hello, can you hear me? Oh, there you go.
Yeah, I can hear you great.
Okay, yeah, you started breaking up right after you started to explain where you were, and I was trying to tell you, but it kind of froze there.
Oh my gosh, of course, right when I'm talking about the good stuff, where we are. So we are on, can you hear, you can see me good? It's a little blinding with the sun.
Yes, we can see you.
Yeah, you know what, this is better for me. So we are on US 1, 2 miles south of Nice High School, 5 miles north of Palencia, in the shopping plaza, Shops at St. John's Oaks, where the new Irish pub is. Man, I am sweating. My wife and I, we own Lighthouse Chiropractic, which is a family-based chiropractic office. We do see accident cases. So if anyone's ever in an accident, they can come to us for their chiropractic care. My wife, she is certified and specializes in pediatrics and pregnancies. So when you're pregnant, when you're about to get ready to give birth, or afterwards to see the baby, she does all that. And then I specialize in everyone else, or I guess I'd say see everyone else. And we're very clear on what we do. We do a detailed consultation. We have digital x-ray on site, so we take the x-rays right away if necessary. We do a thermal scan, a muscle tension scan, and stress test to be able to see the function of the nervous system. And we're very clear and honest about what we see. And we have affordable prices for people to come see us. And anyone who mentions this broadcast, this interview, we will happily do a complimentary consultation to sit down and see if chiropractic is right for you and if our office is right for you.
Awesome. Well, thank you. Thank you.
Awesome. Hold on 1 second. I don't know if you're going to put that on there. Our website is getlhc.com. So the LHC is Lighthouse Chiropractic. So getlhc.com. You can go there and find out more about our office and what we're all about.
Yes, and I will put that in the description of your video. But thank you so much for your time. I am so excited about getting this out there to people and having more to learn about more alternative health care. So this is awesome. Thank you.
Wonderful. Thank you for the time.
And thank y'all out there for your time and watching as usual. And we will see you next week. Thank you. Bye-bye.